Victor Barajas, the NHANES study coordinator in Davidson County, joins us now. Victor, why is this so important for the CDC?
Well, this is very important because all the health data that comes from this study is used to create health policy. We find out about diabetes rates, obesity rates. We find about cardiovascular diseases. This information is essential to create health policy that affects all Americans. But not only that, the participants get to have an exam that is worth over $5,000 that is completely free for them, and they get all the results that they can share with their doctors and medical providers as well.
There's a three-step process to this examination. When the examiners show up to your door, how will you know they are not imitators or scammers?
Absolutely. That's one of the first things that we want to address. Is a great question. The first thing we're going to do is we're going to send you a letter that looks like this. And this is going to be an official letter coming from the CDC. And that you can see in the back of the envelope that is an official letter. It's an official government letter. And we send you the letter. And this means that your household was selected. Then the next step, inside the letter and the envelope, you're going to receive a letter that looks like this. And in this letter, it tells you that we're going to be visiting your house. Now, we're going to begin this survey starting tomorrow, Friday the 31st. And we're going to have one of our interviewers stop by. They're going to show you a badge that looks like something like this. It's an official badge from the CDC. And then they're going to be having this badge. And inside the actual letter, it's actually going to be this magnet that looks like this. And this also comes from NHANES and the CDC. And they're going to ask you very simple questions. And these questions relate to age, number of people that live in your household, race, and ethnicity. And then based on this information, the algorithm is going to see whether or not you get selected. Now, if you happen to be selected, which would be, we call it the health lottery, we only examine about 5,000 people across the U.S. per year. So if someone gets selected, they get to represent 65,000 other people with the same age, race, and ethnicity. And the second step of the process is an in-person interview. It takes about an hour, and we'll be asking questions related to health and nutrition. What kind of food do you eat? How often do you exercise? You eat fast food and things like that. So it's just going to be questions related to health and nutrition. And then after that, you get to participate in the health exam, which is the most important part. In this health exam, you get your blood pressure, you get a dental exam, your body weight, you get a balance test, you get blood work that, it's going to, test for environmental exposures, and test for lead. You get a kidney liver function as well. You get a DEXA exam, which is a full body scan. So all of these exams are worth, like I said, over $5,000. And that will be the last step of the exam process. Will be the interview process when someone goes to your household, whether you get selected or not. And then if you do get selected, it's an in-person interview that lasts about an hour, and then the health exam, which could range anywhere between 2 and 3 hours. And again, this is where we get all the information, and you're able to share all this information with your medical provider.
What information will they not ask you for?
That's a very good question. With the questions deal more with health and nutrition. So they'll ask, your level of education. They'll ask how many people in your household, your income level, your education level, and then what kind of food you eat. If you eat fast food, if you eat frozen food. They ask you the portions of the different items that you eat. There is a question, I know you had asked me about the Social Security. One of the things that we want to emphasize that all the questions are voluntary, and you don't actually have to, if you can always refuse any of the questions. And there is a Social Security question that is asked, and that question is used to track mortality rates. So they'll be able to track, your base, again, 65,000 other people, age, race, and ethnicity, over time to compare that with the mortality rates at the end. I mean, unfortunately, when someone passes away. So there is that question, but again, like I said, this is a question that we put out there, and then all the questions can be, refused if you don't feel comfortable answering the questions.
And everything is confidential for the first part of the interview. Like, are there going to be any names published in this survey?
Absolutely not. Like, that's one of the things that we emphasize over, this survey has been going on over 50 years now. We've never had a breach of confidentiality. All the information is once you get selected, you become a number. We call it a participant ID, survey participant ID, and then all of that is associated with that number. And your name is not used in any context. So your information is completely private. Once the interviewer enters that information into their computer, it goes into our servers, and they're completely private. And so there won't be any risk of your information being divulged, your name, or anything related to you as an individual. It's completely safe, and it's very secure. And like I said, and the existence of this project, it was enacted, by Eisenhower in 1959. We've never had a breach of confidentiality, so you can be sure that your information is going to be very well protected.
Victor, thank you so much. We really appreciate your time.
Thank you.